YouTube, it's my channel of an everyday life of an Aspie. If you're following me right now, I'm Aspie and I'm all about creating mental health and awareness, sharing my life stories with OCD, Asperger's syndrome and the like. And I also do some tips and advice along the way of how you guys can manage and treat your everyday personal struggles of your mental health disorders or whatever it may be. It's been brought to my attention has been some parts of my videos that is missing in the Tourette syndrome series, which I'm going to clearly address right now, even though hopefully this part will be broken down into little bits of the series so that you can follow little by little of what you see and maybe taking of interest for you. So this was just the introduction of tics as a promise to do some research and share with you all what I'm aware of what I know of it, and that hopefully in this that we can learn together. And just as a disclaimer before I begin this is that I'm no medical doctor, I'm just your normal everyday Joe blogs, minding my business and just trying to live my life as best as I can. So if you see any signs or symptoms in relevance to any of these topics that I share, do seek professional help or seek an opinion for yourself or your loved one. So let's begin this, even though that this hopefully will only be two parts, which I'm going to, for the first part, for the introduction of the tic, is basically what is it, the types, the description, and basically maybe like when to call the doctor or not, but we'll see how we go anyway, time permitting, as well as the causes and symptoms. So let's begin this. So the question as you'll be asking me is, what is a tic? Well, like I said, many kind of clinical doctors and everything else in between do define these in different terms. So in this retrospect, for how I look at it, tic is an involuntary, compulsive, rapid, repetitive stereotyped movement or vocalization experienced as irresistible, although it can be suppressed for some amount of length of time. However, occurrence is increased by stress and can be reduced during sleep or engrossing some activities that they are engaged in. Tics may be of psychogenic or neurogenic origins and are subclassified as either simple, such as your eye blinking, shoulder shrugging, coughing, grunting, snorting or barking, or into the complex tics, which are your facial gestures, grooming motions, coprolalia, which is the obscene language that I've shared with you all before, echolalia, repeating the most recently heard word or sounds, or echokinesis, which is your imitation of one another's movement. Tic douloureux is a painful disorder of the trigeminal nerve increased by severe pain in the face and forehead on the affected side, extending to the midline of the face and head, triggered by stimuli such as cold drafts, chewing, drinking cold liquids, brushing the hair or washing the face. This is called also trigeminal neuralgia. I'm hoping to get a diagram basically to show you where I'm talking about for this part of the tic section. As I said before, coprolalia is a compulsive, stereotyped kind of use of obscene language, particularly of words relating to feces, seen in some cases of schizophrenia or Gilles-de la Tourette syndrome. As you know, basically it's not always the case though, however for some words that are relating to feces it can be other words as well. So tics are a type of dyskinesia, which is the general medical term to give impairments or distortions of voluntary movements as it's defined as. Although tics may vary considerably in severity, they are associated with several neuropsychiatric disorders in children as well as adolescents alone. The American Psychiatric Association, or APA, defines 4 tic disorders in the 4th edition of the Diagnostic and Statistic Manual of Mental Disorders, or DSM-4. The disorders are distinguished from one another according to 3 criteria: the child's age at onset, 2 the duration of the disorder, and 3 the number and variety of tics. Transient tic disorder is also known as benign tic disorder of childhood. This criteria of transient tic disorder specifies that the onset must occur before the age of 18 years. The tics must occur many times a day, almost every day, for at least 4 weeks, but no longer than 12 months. The child must not meet the criteria for Tourette syndrome or chronic tic disorder. Chronic motor or vocal tic disorder, To meet the diagnosis of chronic tic disorder, the child must be younger than 18 years of age. Tics must have occurred nearly every day or intermittently for a period longer than a year, without a tic-free interval longer than 3 months. The tics must be either vocal or motor, but not both, and the child must not meet the criteria of Tourette disorder. Tourette disorder, also known as Tourette syndrome, obviously is mostly considered as the most serious case of the 4 tic disorders. Okay, basically also just to be on mind, the DSM-4 criteria for Tourette disorder specified that the child must be younger than 18 years of age at onset. The tics must include multiple vocal as well as motor tics, although not necessarily at the same time. Tics must occur many times a day, nearly every day, or at intervals or over a period longer than a year without any symptoms for intervals longer than 6 months. There must be variations in the number, location, severity, complexity, and frequency of the tics over time. The tics cannot be attributed to the effects of substance such as stimulants or a disease to the central nervous system. Tics disorder not otherwise specified. This category includes all cases that do not meet the full criteria for any of the other tic disorders as mentioned. The description of a tic: tics most commonly affect the child's face, neck, voice box, and the upper torso, but may also include any other body part. The experience of having a tic is difficult to describe to those who have been troubled by them or never experienced them. Having tics may be compared to having a sensation of having to cough because something is tickling one's throat or nose. Sensation is irresistible and immediate. The types of tics that include are the following. Simple tics. These ones involve only a few muscles or sounds that are not yet words. Examples for this of the simple motor tics may include nose wrinkling, facial grimaces, eye blinking, shaking the neck, shrugging the shoulders, or tensing the muscles of the abdomen. Simple vocal tics, however, may include grunting, clucking, sniffing, chirping, or throat clearing noises. Simple tics rarely last longer than a few hundred milliseconds. Another one is the complex tics. These will involve multiple groups or muscles or complete words or sentences. Examples for this are gestures such as your jumping, squatting, making motions with hands, twirling around when walking, touching or spelling an object repeatedly, and holding their body in an unusual position. Complex motor tics last longer than simple motor tics, usually several seconds or longer. 2 specific types of complex motor tics that often cause parents concern are coprolalia, which involves the tic in a vulgar, obscene gesture, and echokinesis, which the tic is a spontaneous imitation of someone else's movements. Similarly, complex vocal tics involves full speech and language, which may range from the spontaneous utterance of individual words or phrases such as stop or oh boy to speech blocking or meaningless changing in the pitch, volume, or rhythm of the child's voice. Specific types of complex vocal tics include coprolalia, which refers to the child's repetition of a certain words. Again, coprolalia, which refers to the use of certain obscene words or abusive terms for certain racial or religious groups, and echolalia, in which the child repeats someone else's last words or phrases. Sensory tics are less common than either the motor or vocal tics. This term refers to repeated, unwanted, or uncomfortable sensations, usually in the child's throat, eyes, or shoulders. The child may feel a sensation of the tickling, warmth, cold, or pressure in the affected area. Phantom tics are the least common type of the tics. A phantom tic is an out-of-body variation of a sensory tic in which the person feels a sensation in other people or objects. People with phantom tics experience temporary relief from the tic by touching or scratching the object that is involved. Other features of tics to just bear in mind is tics typically occur in bouts or episodes alternating with periods of tic-free behaviour lasting from several seconds to several hours. They generally diminish in severity when the child is involved in an absorbing activity such as reading or doing homework, increase frequency and severity when the child is tired, ill, or stressed. Some children have tics during the latter stages of sleep or wake up during the night with a tic. Severe complex motor tics carry the risk of physical injury as the child may damage muscles or joints, fracture bones, or fall down from an episode of these tics. Some children may harm themselves deliberately by self-cutting or self-hitting, while others hurt themselves unintentionally by touching or handling lighted matches, razor blades, or any other dangerous objects in their reach. Severe complex vocal tics may interfere with breathing or swallowing. Causes and symptoms just to bear in mind. The causes of tics and tics disorders are not fully understood as of the early 2000s, but most researchers believe that they are multifactorial, or the end result of several causes. In the early 20th century, many doctors influenced by Freud thought that tics were caused by hysteria or other emotional problems, and treated them with psychoanalysis. Psychoanalytic treatment, however, had a very low rate of success. Since the 1970s, however, researchers have been looking at the genetic factors in tic disorders and Tourette syndrome alone. With regards to Tourette syndrome, genetic factors are present in about 75% of children diagnosed with TS, with 25% having inherited genetic factors from both parents. The exact pattern of genetic transmission was not yet known until 2004. However, autosomal dominant, autosomal recessive and sex-linked inheritance patterns have all been studied and rejected. Some candidate genes for Tourette syndrome have also been tested and excluded. What is known is that the patient's environment and heredity play a significant part in the severity and cause of Tourette syndrome. Tics disorders as well as OCD sometimes develop after infections, usually scarlet fever or strep throat, caused by a group of bacteria known as a group A beta hemolytic streptococci, which is sometimes abbreviated as GABHS. These disorders are sometimes grouped together as PANDAS disorders, which stands for pediatric autoimmune neuropsychiatric disorders associated with streptococci. Some researchers think that the tics develop when antibodies in the child's blood produced in response to the bacteria cross-react with proteins in the brain tissue. The connection between streptococcal infections and tic disorders is questioned by some researchers, however, on the grounds that most children have a GABHS infection at some point in their early years, but the vast majority, say 95%, doesn't develop OCD or a tic disorder. There appears to be a closer connection between syndromes chorea, which is a movement disorder, and GABHS infections that between tic disorders and these infections. One prospective study done at Yale reported in 2004 that new GABHS infections do not appear to cause a worsening of tics in children diagnosed with OCD or Tourette syndrome. Neuroimaging studies have shown that tic disorders are related to abnormal levels of neurotransmitters such as dopamine, serotonin, and cyclic AMP in certain parts of the brain. A neurotransmitter is a chemical produced by the body that conveys nerve impulses across the gaps or synapses between these nerve cells. In addition to abnormalities in the production or absorption of these chemical messengers, imaging studies indicate that the blood flow and metabolism in a part of the brain called the basal ganglia are abnormally low. The basal ganglia are groups of nerve cells deep in the brain that control movement as well as emotion and certain aspects of thinking. In contrast to the low level of blood flow in the basal ganglia, the motor areas in the frontotemporal cortex of the brain shows increased levels of activity. The various types of tics themselves have already been described as shared with you all today. Other symptoms that may be associated with tics and tic disorders may include obsessive thoughts, difficulty concentrating or paying attention in school or work, forgetfulness, slowness in completing tasks, losing the thread of certain conversations. These symptoms are usually regarded as side effects of interrupted thinking or behaviour caused by the tics. So this quickly ends the introduction of what is a tic, the symptoms and causes. Give me the like for thumbs up for support and engagement. Comment below if I missed out anything, or just comment below to say hi Aspie. Feel free to subscribe to my channel for more updates of what I'm going to be up to, as well as putting on that notification bell so that you are up to date with my everyday activity of my videos of what's coming up. Feel free to share these videos around to family and friends. Feel free to also basically follow me on my social media sites, AspieAnswersAll on Twitter or Facebook. If you feel the need that you want to comment on that, feel free to comment or send me a message either through YouTube or through my AspieAnswersAll page if you need someone to talk to, or just throw at me some questions. And all further ado, guys, thanks for support, thanks for watching, do what you love what you do. Until next time, Aspie signing out. See you.